They say a smile is the shortest distance between two people, but maintaining that smile is both a science and an art. Today, we are joined by a specialist in the field of modern dentistry here at Neoderma Clinic to share insights. Beyond just routine care, we are diving into how oral health acts as a window to your well-being. From the latest in cosmetic smile enhancement to the critical importance of preventive care and restorative treatments, we are uncovering what it takes to achieve a smile that is as healthy as it is beautiful. Dr. Hirwa, thank you so much for joining us today.
Thank you so much. Thank you for hosting us.
How are you doing?
I'm fine. How are you?
We are happy to be here at your clinic to learn more about the services you offer and why dental care is very important to the well-being of every person.
Thank you so much.
So I would like you to begin by introducing yourself and the ecosystem in which you operate.
Thank you so much. My name is Dr. Hirwa. I'm a dental surgeon working here at Neoderma.
So Dr. Hirwa, what kind of services do you offer here?
We offer different services. One of the services we offer preventive care. We offer restoration care. We offer orthodontic. We offer also oral surgery procedures, and offer also cosmetic dentistry. In preventive care, one of the procedures we do cleaning. We do fissure sealant for little kids. We do oral hygiene education for the patient who come to see us. In cosmetic dentistry, we do teeth whitening. We do also veneers, direct veneers, which are done on the chair side. We do also indirect veneers, which is we take impressions and we send to the lab to do as veneers. Or in orthodontic care, we provide orthodontic braces, aligners for people who had crooked teeth, those teeth which are malaligned. Also, as I said before, we offer oral surgeries for impacted teeth extraction. We also offer implants. In restorations, we offer filling for teeth which are decayed. We offer also crown for badly damaged teeth. We also offer bridges for those who have extracted tooth and they have started to develop, the tooth start to shift. So the oral cavity is not in balance. So we offer those kind of bridges to restore the balance in the oral cavity.
From experience, I've seen many people postpone dental visits. Yeah. Unlike many other diseases, people don't really pay attention to dental visits unless it's really the pain has gotten to another level.
Yeah.
And I think all of us know how bad it can get.
Yeah, of course, yeah.
So how important is it for people to visit, clinics early enough?
Really, it is really important. As main of the advice we give people is start to do dental visits as early as children. When they start having tooth eruptions, you should start coming to visit dental clinics so that we can see, or we can look after you until at old age, so that you can maintain your teeth. Because like people, they come to see us when they already have the issues, and that really doesn't help much. It is costly, and your health is really in not good shape. But as you come early to see us, it helps you a lot. So what I can tell people is to come early as possible, so that we can help them early as we can.
Many people worry about, confidence in terms of how their teeth looks like. How do you, as a clinic, help people improve their overall confidence?
Yeah, what we do, like let me say, for example, there is this issue of halitosis. What is halitosis? Halitosis is bad breath, as many people they say bad breath. Main reason of bad breath is poor oral hygiene. It is commonly everywhere. You know, people, like, it affects people psychologically, like at home, husband that doesn't talk to their wives. So it helps their it is really affecting people's life. What we do, as I told you, we do oral hygiene education. Many people they doesn't know what is the time of brushing and how to do it. I mean, the technique. So that's the offer. As they come to visit us, I really took my time educating people about that. People, they care a lot about how they look, you know, the confidence. People who doesn't really pay much attention in their daily schedule. For example, like those people who has a habit of drinking a lot of coffee, those people who has a habit of smoking, they stains their teeth. So when they come to us, we help them gain their confidence by doing teeth whitening. It really does much help a lot. Also, people who has, as I told you, if you don't take care of yourself, like, I mean, in terms of hygiene, you only lose your teeth. Then when another set of the teeth erupts, you start developing crooked teeth. You know, that's where we come in with orthodontic care. That's one of the main care we offer here. And also, as I told you, like implant, we do implant here. Like it is one of the main way to replace lost teeth. You know, it really, we offer those different services to people so that we can try to help people gain their health back, gain their smile back, you know. Yeah.
Great. And also, there are many clinics that are popping up here in Kigali. So what sets Neoderma Clinic, you know, apart from the rest that we see around?
Oh, that's a good question. As here, our main focus mainly is customer care. We really focus a lot on that, and also cosmetic care in terms of dentistry. We offer tooth whitening, we offer veneers, and also orthodontic care, treatment, so that we can help our patient in that. That's what set us beyond other clinics, I think, here in Rwanda.
And for a visitor, or for a normal Rwandan or any other person who is visiting this clinic for the very first time, what sort of experience should they expect?
They should expect the best of the service. They can really dream here in Kigali, from the reception, from the nurses who receive them, and mainly from us, the doctors, because as our care is to provide the best of the service to them, so that we can meet their expectations as much as we can, because in the end, that is our goal as the clinic, and I think we match well as their vision when they come to see us.
Great. And I'm also curious, there is a very interesting tool here. So what do you use this for?
Oh, this really helps me a lot, you know. It helps me a lot because many people come to see us without really knowing the main cause of what happened to them. And this is, as you can see, it's a replica of our oral cavity. Mm-hmm. Yeah, this is the teeth, and for the lower jaw here, our mandible. And this is the replica of the upper jaw, the maxilla. And this, I love this tool a lot. Mm-hmm. And this is the toothbrush. What I can tell people, when they are trying to buy their toothbrush, they should look for a toothbrush which is really soft here, And you might have this. If you don't really know how to use it properly, it doesn't really help you a lot. That's the issue. What I do, I teach them how to proper brush, the proper technique of brushing. And what also I tell them, people when they brush, they use a lot of force, which doesn't really does much. What it really helps is like the technique and taking your time. What you do, the first application of your toothbrush should be at the junction between the tooth and the gum. That's where your first application will be. So what is the motion we do to clean that surface? It's a vertical motion from our first application of our brush to the incisor edge where our teeth meet from down here. You see, if you do as many people does, it depends on your brush, but there are some surface you are not cleaning well. That's why we came with all this motion from where the tooth meet the gum until where the tooth meets, or as you can see.
Yeah.
See, this is the motion. So this where many people I see the effects of not bad cleaning. It's here. What you do, you take your brush like this. You see, from where the tooth meet the gum, the junction, to up to the incisor edge. Okay.
Yeah.
If you clean like this, believe me, you'll be having no issue. Okay. When it comes to the back side, as I said, the surface which meets the cheek, it is the surface which matches the cheek. The first application, it is, as I said, in the front here, up like this. You do like this. You do like this. When you're going in the inside, you turn your brush like this. You clean. So the surface where we use when you are chewing our food, how do we clean it? As far as you go posteriorly, you cannot. The whole brush can't fit in. So we try to the tip of the brush. The motion is like sweeping, like you're sweeping the floor.
Interesting.
Okay. What you did here is exactly what you do here. What you did here is exactly what you do here. What remains, which is the most important thing, it is the tongue. It is the most part in our oral cavity which retain the debris. What you do, how I do it is like I divide the tongue into three parts. The one which is near the cheek of the left side, and the middle part, and the right part. As like this, if you clean it like this, what I can tell you is your oral cavity will be well cleaned and you will have no issue.
Interesting. Thank you, Dr. Hirwa, for that explanation. So now, to talk about oral hygiene, how many times should people brush their teeth, when and how?
People should brush twice a day, mainly at night and also in the morning. In the morning after taking breakfast. I mean when they wake up. Why? Because imagine you brush when after waking up and you had the breakfast, okay? So you are going the whole daytime, you are going to remain with those food debris, which is really going to affect you with bad breath, and also the bacteria will be having the rest of the remnant of the food. So that's the reason why we advise people to brush after having breakfast for a period of 5 minutes. And remember, you are going to have lunch. There are people who snacks, and you are going to have even dinner. Can you imagine going to sleep like that without even cleansing your mouth?
Yeah.
So because of all those activities we went through the whole day, so it is very crucial. I advise people, please leave the narrative of brushing when you wake up. You have to clean your mouth before going to bed. And after finishing cleaning your mouth, the only thing which you can put in like you can drink water, you can have natural yogurt, you can have milk. Why? Because the sugar which is the milk, which is lactose, it is not refined sugar which our microbes which in the mouth uses. They are butter solution, so it doesn't affect. But other thing which is of sugar, like so sweet soft drinks, other drinks, we shouldn't use it. What also can tell people, all people like adults, we need to put a Colgate of a size of a pea. That's what we need. We don't have to fill the whole brush with paste. For children, they have to put like a Colgate of a size of a grain of rice. That's all we need. When we brush, after finishing, we should take enough of time, like let me say for a period of from 3 minutes to 4 minutes or 5 minutes. Why? Because remember, the toothbrush is soft. We should take enough time to clean our oral cavity throughout well. When we are sure that we clean our mouth, there is this thing people should know. We spit, we don't risk oral cavity. Okay? Why do we spit? Because when we spit and we don't rinse, there is when you have spitted the Colgate and all those things, there is small thing of Colgate which remains in oral cavity. That mixes with saliva, and remember in the Colgate there is antimicrobial activity, which our body absorb and go where our toothbrush cannot reach to kill those bacteria. And so we should spit the Colgate and rinse outside the mouth where there is the remnant of the Colgate. Okay. Yeah.
Wow, interesting. Yeah. I think I've learned something new today. I hope that our audience has also learned something. Yeah. So what is your final word to the people watching you?
One is what I can tell them is to really come to us so that we can help them. One visit once in 6 months can make a difference in your life. Leave that mentality of coming to us when you are in much pain. We will still receive you, but if you come earlier as possible, we can try to help you better than that time when you are really not doing well.
Interesting. Those are very insightful remarks from you. And now to our audience that is watching us right now, how can they get you? Where are you located?
We are located at Chibagabaga, near public hospital, in a building called Convenient Plaza. That's where you can find us.
Dr. Hirwa, thank you for making time to talk to us and for hosting us at your beautiful offices here. Thank you so much.
I hope so, yeah.
And to our audience who have been watching us today, thank you for making time to join us. We hope you found this conversation insightful. Until next time, it's goodbye for now. I was your host, Wycliffe Nyamasege.